Program Science has been effectively adopted by Karnataka Health Promotion Trust in the MNCH project funded by Bill and Melinda Gates Foundation for improving maternal, newborn and child health outcomes through a focused effort in 8 backward districts in northern Karnataka. To begin with, the project team gathered secondary data from national surveys in relation to MNCH situation and coverage of indicators.
We did extensive situation assessments. We did facility mapping to understand availability, accessibility. We did extensive quality assessments to understand the quality of service delivery, as well as some surveys and specific qualitative in-depth interviews to understand the barriers on utilization and coverage.
The data was shared with the state government since the program aimed at providing technical support to National Rural Health Mission. Possible intervention opportunities were explored and a clear implementation design was developed.
We had a very clear implementation design, and each level of implementation, what are those interventions that we need to implement and what level of implementation, and how each of the interventions between community and facility and health system would tie with each other. So that is how we actually went about. One major gap that we recognized in the facility service deliveries, there is a lot of gaps in the quality of service delivery. How to really improve the quality was a question that the group had to face. And when we looked at evidence elsewhere, there was a mentoring program that was tried out in some context. We realized there's a great opportunity in terms of trying out something called nurse mentoring intervention. We thought who else would be better than somebody other than a nurse. So we thought we'll train or build a new cadre of nurse mentors to work with these staff nurses and improve the quality.
On the community front, tools such as Community Demand List, the CDL, Asha Dairy, Home-Based Family-Focused Communication Materials, the HPFFC, and Supportive Community Mentoring Tools, the SEMT, were developed. These tools were pilot tested before scaling up.
We all talk about the tools at different level, tools to get the data. Okay, I need information. What is how many deliveries are conducted, how many children got immunization. You have a tool and you can plan better. You can reach right people. So all this need to be understood by the frontline health worker. So this tool is another empowerment technique as part of the maternal and child health. So this is something where the frontline health worker can sit together and plan their own program within their community with the help of village structure. This is one part, and the tool should facilitate them to understand the ground realities and plan their day-to-day activities. This made them the complete continuum to achieve the continuum of care. So we had all the indicators, so they are tracking right from the day 1 to the end.
This is a vital component of program science. A robust monitoring and evaluation framework was put in place,
where we did a comprehensive mapping of all facilities, public health facilities all, and few delivery points, private delivery points, quality of MNCH services, the critical MNCH services. We analyzed that data. That data was always helpful for us as well as the Department of Health and Family Welfare for their program implementation plan. We had a community level pre-post design. We did the baseline in 2012, we did the end-line in 2015, and we found a 10 percentage point decline in these 3 years in neonatal mortality rates in these 8 project districts. In Bellary and in Gulbarga, we did this RCT, the randomized control trial.
Evaluation found that integration of science into program resulted in significant improvement in MNCH outcomes.